similar report. Non-transfusion dependent had a lower score in comparison to transfusion dependent thalassemia. Patient in general with the thalassemia, they reported decreased quality of life. And in general, non-transfusion dependent were lower than transfusion dependent. A similar study, this is basically comparing thalassemia intermediate and thalassemia major, transfusion dependent and transfusion dependent. Almost the same number of patients, more than 100 patients. And the interest, the most of the patients were, the mean age was 26. Here, gender showed a significant better score in part of the parameter. What's interesting, again, higher education and younger age group, not the same as that study done in Saudi Arabia. Higher education is a better score, and younger age group, significant relation with higher quality of life in thalassemia intermediate. And they reported here that the quality of life, at least we would expect it would be better or the same. So we have a report that thalassemia intermediate non-transfusion dependent thalassemia had either worse or not better quality of life reports. And all of those are reports from, like, this is a questionnaire, so usually the patient respond or their caregiver. So I would conclude at the end by saying, when we look into this diagram thinking about the clinical manifestation of thalassemia, we want to remember that's not about transfusion dependent thalassemia only. We need to keep in mind other subcategories like thalassemia intermediate or non-transfusion dependent thalassemia. They are prone to some of the complications, and but maybe they show it up later in life. So we need to keep this in mind. And these two slides is for to be compliant with the Saudi FDA requirement, as a lecture is sponsored by Bristol Myers. You will have further review of that with Dr. Sultan, I think, additionally. And by that, I conclude my presentation. I believe we can have a question now before Dr. Sultan starts. Sorry, I'm being 3 minutes behind.
Thank you, Dr. Iman, for the excellent overview. It was a nice presentation. And now for the question. I think there is a question. I'm not sure whether you went through or not, for whether that thalassemia can affect the fertility. Did you mention that, Dr. Dr. Iman?
Yes, it can affect fertility. It can cause hypogonadism, and this is also related part of the endocrinopathy that can happen for patients with thalassemia, especially with the iron overload. I do remember that there was other contributing factor. It's not a straightforward